The nice thing about it is it doesn't use drugs or medications, so there's really very little side effects associated with its ongoing use. You have a trial first, so that's done through a needle, and the lead is thread into the epidural space covered with a dressing. You have it for a week to test it and see if it'll work first before you'd implant the battery. So if it doesn't help you significantly, then you don't do the implant and it just comes out and you put a band-aid over the hole like you never had it. For the first few weeks, sometimes it might be a month or so, you want to avoid certain strenuous activities like heavy lifting, like bending. So doing, say, squats at the gym, or if you're very athletic, strenuous, intense activity, especially involving weights and flexing, extending at the spine. Eventually, though, there aren't restrictions. Once those leads scar in, you'll be able to do everything normally, swimming, anything in the water, any kind of exercising, running, like anything like that, or I won't be limited with the stimulator. It is actually removable. So I think of it as like a long-term temporary solution. Psychologically, people like that because they don't like something that, oh, what if it changes or it doesn't work? Well, that's not a concern because you can actually take them out if 10 years from now, for whatever reason, you don't want it anymore. Some of it you can actually update, kind of like your iPhone updating its new iOS. You can do that with stimulators too, where you can upload the new programs and the improved technology without having to exchange it. I have patients, it's pretty consistently in tears of happiness because they're like, I've like forgotten what it's like to go through a day without pain or like minimal pain. They'll say, I haven't slept through the night in years. I was actually able to walk my dog. People go back to work on these things. We have about an 85% trial conversion rate in our practice. And that means that 85% of the people who do the trial do the permanent implant, meaning that it provided them enough relief to move forward with that.